Hello, Colin Hung here for Healthcare IT Today. I'm about to sit down with Chris Sulway, the Chief of Strategy at OntarioMD. We're going to talk about the study that they just released on the use of AI scribes. I wanted to ask Chris how that study was conducted and what the results mean for physicians. Let's get to it.
Chris, welcome to the program.
Thanks, Colin. Glad to be here.
I'm excited to dive into that AI study that was just released by OntarioMD.
Yes.
Before we get there, can you tell our audience a little bit about what you do at OntarioMD?
Yes, I can. I'm the Chief of Strategy and Stakeholder Relations at OntarioMD. And for the last year, I've been working as one of the executive leads on the AI Scribe evaluation project.
So talk to me a little bit more about that AI Scribe project, because I just read the results and they are phenomenal in terms of doctors are really excited and see value in AI scribes.
Yeah, it was a really outstanding results from that. I think there's a couple of things. The report really captures the importance of having this type of evaluation informed and led by physicians. And then I think you can have a greater confidence that the value proposition that's being described really resonates with physicians. And I think that really helps get the attention of doctors and potentially support the spread and scale of this technology. The results, as you suggested, were quite something. You obviously see the impact it has on time savings, but I think the parts that I really enjoyed to hear about was the impact it had on patient care. You had patients and physicians saying it allowed a more deeper conversation. Those physicians weren't having to multitask while they were trying to have that interaction, which I hear them say that it also impacted on their cognitive load. They weren't having to multitask all day, take in different bits of information, and they leave the day in less burnt out, which I think is a really positive thing when you hear that from a technology product.
Yeah, that was really surprising to hear you say that. We hear about obviously the time savings, but the cognitive load is something that vendors have been saying, but it's nice to have that verified by actual physicians.
Exactly. Yeah, if you think about what engagement looks like now, the doctor starts talking with the patient, but then inevitably within minutes, they have to start thinking, okay, how do I capture this into my EMR? What do I type? I have to be typing and listening. Whereas now they can face the patient directly and really focus on the key value, which is the differential diagnosis, understanding what the problem is, and coming up with an effective plan. So I think it yields great benefit for both the patient and for the physician.
So Chris, I really want to dive into this one aspect with you. How do we move from sort of this positive buzz, the hype around AI scribes, to actual implementation? So what needs to happen now that we've kind of verified that, yes, it's a good thing, but how do we get people to adopt it?
Yeah, and I think it's a great sequential step. First, you have clinician-informed evaluation that confirms the value. At the same time, we did work to understand if there's any regulatory or privacy concerns that need to be mitigated. And now we're exactly at that stage of spread and scale. So in the report, we heard doctors say that there are two main things that are potentially preventing them from adopting this. One, they want to make sure that this is safe for them to use, so that their regulatory body says it's okay, the ministry says it's okay, the people that insure them all give it a green light that yes, in its current state, this is safe for me to bring into my practice. The other part was cost. Primary care is delivered by a collection of small businesses, so any new expense is a new expense. So I think we're at this stage where key stakeholders like OMD, the OMA, the ministry are all now taking a look at those two key barriers and determining what it is that we do to clear that path. And I think if we go back to doctors with a clear roadmap that addresses both of those issues, I think we could see dozens and hundreds of doctors starting to adopt this type of technology.
And do you think we'll be at the point where do we just have to open the doors and people will come if those hurdles you just mentioned are addressed? Or do you think we're going to have to go door to door and really kind of convince physicians to really try this and give it a go?
Yeah, I think there'll be a bit of both. We've already seen the early adopters of the curve pick this up and really speak to their peers around how transformative this is. You hear people thinking, I was thinking of retiring or closing my practice, and now I'm ready to stay. When you get those types of messages coming from your peers, it gets people's attention. This is something that has a high impact. So I definitely think the voices of doctors will then influence other doctors. I think again, but also organizations like OMD and the Ontario Medical Association will also have a role of encouraging doctors to try this technology. And I know that the Ministry of Health is equally interested. You can imagine this at a system scale. They are very interested in trying to get this type of innovative technology into primary care to help them address some of the challenges they're having.
Now, of course, in the Canadian system, revenue isn't a metric of success, but implementing this type of technology, is there a real clear ROI for Canadian physicians to implement this? Or is it really much more around the improving the lives of clinicians and the experience for patients?
Yeah, I think you could look at it at both angles. Definitely, if you free up a half day a week, that increased capacity allows you to see more patients. But I think the other perspective we're hearing from doctors is that time saved is not necessarily happening during the workday. It's decreasing the time after hours or on the weekends. So I think from a doctor's perspective, the part that we're hearing struggle is that burnout, is the crisis within primary care. And I think these types of tools bring back a joy of medicine. It's part of the tools that help to incent doctors to be part of family practice. And I'd say that's probably some of the largest impact we could hope to get from this.
You mentioned some of those next steps, Chris, in terms of, now this study's been published and some of the things that you and the OMA and other folks are working on. But what's next in terms of on the physician side? What should they be doing? What message would you like to give to them about AI scribes?
Yeah, I think they want, a report like this and hearing from their peers, what is that value proposition? I think the other part that they have to is start to look at this in terms of a trial and to see if they want to bring it in. What we heard from physicians is that this is relatively easy to bring into their practices. It's not something that involves reworking workflows or changing staffing models. What the feedback we got from clinicians is this is relatively easy to start to use and to bring it into the clinic.
Chris, you've shared a lot of great information with us. Where can people go to learn more about the study and learn more about what OntarioMD is doing?
Yeah, you can go to the OMD website. We have a section there on AI and AI Scribe. You can find a host of different resources there to give you more information.
Chris, thank you so much for being on the program today.
Thank you, Colin.
I want to thank Chris for joining me on camera to talk about the AI study. It was clearly important to Chris and to OntarioMD that this study was put together by physicians for physicians. And hey, if you enjoyed this interview, it would really help us out if you can click that like button and subscribe. Also, head on over to healthcareiTtoday.com for more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.